Our mission is to save and improve lives. It's that simple. That's why thousands of people at Central Missouri here at MU Healthcare got up this morning. And our vision is that we want to be Missouri's premier academic health system.
We knew that 10 years ago that this partnership was going to be the first of its kind, and it's going to be a model for other universities to replicate.
The work that we're doing to create this system of care in partnership with Cerner and the Tiger Institute is something I'm incredibly proud of.
You look around now at healthcare, technology is just becoming woven into every aspect of it.
The work that has been done through the Tiger Institute, the innovations that we were able to achieve, make us more valuable to the healthcare recipients that we have in the state. So together, we're making an important difference for healthcare in Missouri.
Extending the Cerner platform to our partners, to our affiliates and other subsidiaries is a very good thing because we share so many patients together.
The Health Network of Missouri is a nonprofit collaborative of hospitals. We share quality data, we work together as a clinically integrated network.
All of our IT folks here at Capital Region became part of the Tiger Institute, and we've been since on a journey to implement our electronic health record.
As we're recruiting physicians, we really get to tell the story that when they're joining our group, they're going to be on a single platform.
We're going to have one of the first non-owned collaborative affiliations in place from a healthcare technology standpoint that exists in this part of the country.
The patient is absolutely critical. A patient shouldn't have to travel as much as they do to currently get those services.
That patient needs to be seen here at Lake Regional, and then ultimately we determine that they need a higher level of care.
That record will follow the patient whether transferring back to a community hospital or if they're transferring to us as a tertiary care center. It will be the opportunity for the nurse, our providers to dive into that record, and it will be a safer environment for our patients.
That's going to help us grow and help us succeed over time.
Most exciting is the ability to not just affect it one patient at a time, but actually to affect the care of a population.
We now have data through Healthy Intent to assess the overall quality, safety, service, and efficiency in our financial performance.
And we turned to our value creation office. The team really dug into what is the information that we have now, what are the resources that we have now.
We're looking at predictive analytics to proactively reach out to patients to potentially avoid readmissions.
And then have the analytics in the background to track whether or not our activities are actually leading to the desired outcomes.
Technology has really revolutionized how nurses go about obtaining medications to deliver to their patients.
We can take that quote-unquote loony idea and head downtown to our engineers and say, okay guys, what do you think? Could we actually build this? Could we make it work?
To use a team that has great clinical knowledge along with operational excellence and an IT team that understands that the value comes from how the people use the IT solution makes it a much more powerful role.
The portal is one of the more important ways that we connect to our patient.
If hypertensive patients are more engaged in their blood pressure, do they experience better control of their hypertension?
We've got more than 100,000 of our patients connected to us through the portal. It is such an important way that we're a part of their daily lives.
Many universities have visited the Tiger Institute to see how we were able to develop this successful partnership. Now we're looking forward to say, what is the next phase?
So much of our growth has been brought about by our current and future partners.
When you have organizations that are committed to each other, the magic that we can make is truly amazing.
Our staying power is focusing on the people, the patients, our relationships.
Things change so fast. We have to all be engaged in learning each and every day, and that's what's going to make the difference for us and for the patients that we're privileged to serve.